Hello, I'm Carolyn Robinson. I'm the Regional Director for Practice Change at Solutions Journalism Network. I'm here today to lead you through a presentation on how to use solutions journalism principles in your coverage of the COVID-19 pandemic. We like to call this kind of journalism hope with teeth, because solutions journalism focuses on what's working to fix a problem, along with clear evidence of its success or failure and limitations in the approach too. In other words, it's using good, rigorous, investigative journalism to focus on responses to problems. Have a look at this pre-coronavirus cartoon in the New Yorker about TV news. We know this, right? People are tired of bad news, and if that's all we give them, they'll get tired of us too. News avoidance is a real thing. People may be watching a lot of TV now, but we need to bear in mind that relentlessly negative coverage can turn people off. Numerous studies show that reporting only on problems is just not enough anymore to satisfy viewers, especially those under 35. Viewers need more. They need the whole story, not just the problem, which is the starting point of your reporting, the basic building block of any narrative, the tip of the iceberg, if you will. Audiences are also looking for other kinds of information, background explainers, tips on how to help, advice from experts, personal stories of impact. But people also want and need credible evidence on ways to fix problems that are actually working, things that are happening on the ground in real time to help them resolve the issue. So here's what we planned for today's workshop session number 1. First, we'll look at what solutions journalism is, and just as importantly, what it isn't. We'll also view TV examples about responses to the pandemic that include the 4 basic pillars of solutions journalism. And finally, we'll share some strategies for applying solutions journalism concepts to your reporting. Then after your team has completed this first training session, we'll schedule a meeting in person, such as it is, and explore together some of the questions you've submitted in advance. We'll also brainstorm together any solution story ideas you send ahead of time. Following that session, we'll remain online to talk with anyone who wants more information, and we're always happy to respond to individual questions at any time as well. So let's get started with this question. What do you want to get out of this workshop? During this session, please keep notes on your thoughts, concerns, and answers to the questions posed on screen to include into the survey when you finish. The survey link is provided in your welcome email. Then we can discuss your feedback during our live upcoming meeting. Okay, so what exactly is solutions journalism? What does it mean? Here's how we define it. Solutions journalism is just good journalism. It's rigorous, evidence-based reporting on responses to problems and the results associated with it. It's an approach that makes a difference for both viewers and for journalists. But you don't have to take our word for it. Listen to what the team at the NBC affiliate KXAN in Austin, Texas has to say about it.
I think often we hear from viewers that you're only telling us about the bad news and you're only investigating the problems. And sometimes we don't think about how do we get past that problem? What's it going to take to fix whatever is wrong with our community?
News can be depressing these days, and folks are really turned off by a lot of that. And so it brings a breath of fresh air and a positivity to the news to say this isn't just a problem, but we're going to also talk about some potential solutions, which really changes the entire feeling when you're both reporting on and watching the news.
The biggest impact that I noticed after we really started focusing on solutions journalism was that our stories were looking different. Whereas before, it may have been a feature. Well, now, because of solutions journalism, that feature story has more to it. And it just made us examine those stories and take it beyond a fluff piece.
And we had a management team that really got behind this. Our news director, our station manager, our marketing director, our sales team, they wanted to learn more about this. They saw the value of this, not just for the station, but for the community. It seems like the audience wanted this type of content. They wanted to know that there was a possibility that this problem could be fixed. And I think that it garnered an interest that we hadn't seen before.
I mean, we've had an amazing reaction from our viewers. We're still getting story ideas in. I'm getting story ideas in my inbox every single day.
To be able to get emails to this day about story ideas, that's amazing. We are more than 6 months in now, and we are still getting content for this idea of solutions journalism that is really become a station-wide effort now.
Here are what we call the 4 pillars of solutions journalism. It looks at a response to a designated problem. It provides insights and details on how the response works. It includes evidence of the effectiveness of the program, not just its good intentions or hopes. It discusses limitations in the approach. It avoids PR hype. It does not come across as fluff, feel-good features, or humorous, upbeat kickers. Doing solutions journalism doesn't mean that you stop covering problems or that reporting on problems is a bad thing. Instead, it's a way to look at those problems through a different lens. To show you an example, these 2 stories from Good Morning America are on the same subject, the spread of the coronavirus. But the first is a classic problem-oriented story. Headline reads, "Much worse than you thought. Italians share messages warning others of coronavirus impacts." While the second, covering the same story with a solutions perspective, is "Flattening the Curve, What South Korea Did Right in the Fight Against Coronavirus." Now let's watch a report from ABC News, which poses a key solutions question. Who's doing it better? In this case, it's South Korea. In the video, watch for story elements that mention the 4 pillars of solutions journalism. What's the problem and the response? How did it work or didn't work? Where is the evidence that this was successful? To what degree? How much? For how long? What's mentioned as limitations of the approach? For example, cost, funding, management, or other challenges.
Now to some promising signs out of Asia as the U.S. looks for ways to slow the spread of the coronavirus and avoid the crisis Italy is now facing. South Korea, which saw its first confirmed case the same day as the United States, now appears to be flattening the curve after an initial spike. TJ Holmes is here with more on how they are doing it. Good morning, TJ.
Good morning, and this should be encouraging news for all of us to see a country like South Korea seem to be coming out of this thing after 2 months. Something they're doing is working, so we should be doing that. Well, we aren't. We haven't, and we might not even be capable just yet.
As coronavirus spreads across the West, new signs of hope in Asia, and in particular South Korea, where there's been a dramatic turnaround. The number of infections skyrocketed there from dozens to thousands in early March. But now they're reporting the lowest number of new cases, just 64 in a single day, since their peak weeks ago. And they didn't lock down entire cities. Experts say swift action from the very beginning was key. That included social distancing, contact tracing, widespread testing, and they were prepared.
They made sure they had enough ventilators, they had enough personal protective equipment, made sure masks were being produced and mass produced. So all those things, that's the full set of epidemic strategies they implemented very quickly.
Both South Korea and the U.S. reported their first case of COVID-19 on the same day, January 20th. But South Korea then did something the U.S. has not, implemented a system to electronically track people and the disease.
South Korea used different types of tracking measures to figure out where people were moving, whether they were violating social distancing measures. So, for instance, if they are supposed to be staying at home, and instead they're out on the street or using public transportation. They were able to figure that out fairly quickly.
Here's an example of how it works. Let's say you find out you have coronavirus. The government then uses your cell phone and credit card data to track where you've been, and then blast out an alert to the cell phones of people who may have crossed your path. Our own Jui Cho showing us what one of those alerts looks like on her phone. Another major difference. Here in the U.S., the N95 mask supply is limited, and the CDC advises people not to wear face masks unless they're sick or caring for someone who's ill. But in South Korea, masks are widespread and encouraged by the government. Monique Claiborne, who is from the U.S. but has lived in South Korea for 3 years, says she doesn't leave home without one.
Masks are actually quite easy to get here from any of the convenience stores or any of the drugstores because people tend to wear them due to the air pollution occasionally anyways. So everyone's wearing masks. People have been very, very vigilant with that.
And back to this idea of testing, they will tell you guys, doctors, that testing is key. Here they're telling us not everybody needs to run out and get a test. In South Korea, widespread testing, because what does that tell you? Where your problem areas are and how to target them. We're essentially in a case where we're a boxer in a ring with a blindfold on. You can throw everything you want at it, but you can't see your target. And that's our problem right now. We're behind in our testing.
It seemed like they had an opposite reaction to how we reacted to it.
They were ready to roll, and they got those tests rolling immediately. They saw their problem areas, targeted them. They knew where to send their masks and their ventilators and everything. So we're a little behind that.
It worked. Thank you,
TJ.
TJ. Here's another example of a TV solutions story. This one from the Canadian Broadcasting Corporation. Can you spot the 4 pillars of solutions journalism in this report? You can add any comments you may have to the survey you'll complete at the end of the workshop.
Putting at least a meter between yourself and someone who might be sick isn't always easy.
This is roughly the distance that's being recommended. So if you're near someone, is this comfortable?
Considering the situation, yes.
For others, it seems unrealistic.
Honestly, like in crowded areas, probably not.
Scientists say social distancing can make a difference if done early enough.
This virus moves really quickly, and that's what we really need to try and work on in terms of mitigation right now.
Singapore and South Korea both have large numbers of infections, but they're keeping people apart. No big gatherings. They even have drive-through virus testing. Unlike Italy, neither country has locked down its residents, but the pace of outbreaks has slowed down, and researchers say Canada could do the same.
It's not outside the realm of possibility.
The research isn't peer-reviewed yet, but models at the University of Toronto suggest even if they find and isolate mild cases, half of the people in Ontario could become infected. But with social distancing measures, people working from home, school closures, canceling of sports events, concerts, and conferences, models show the number of new infections drops significantly, allowing hospitals to keep up with the number of sick patients.
Unfortunately, there's no silver bullet here. There's not going to be one intervention that we can do that's going to make this go away. But I think that social distancing is a really key component.
What do we do on a daily basis where we're in close contact with people around us? And what can we do to try and maybe limit some of those interactions?
Keeping people apart will be socially disruptive and economically damaging, but scientists insist it will also save lives. Christine Birak, CBC News, Toronto.
This next solution story is from WPXI in Pittsburgh about the African American community's response to a coronavirus problem. See if you can identify all the elements of solutions journalism in this video, including at least a brief mention of each of the 4 pillars. You can add any comments you may have to the survey you'll return at the end of the workshop.
We're learning just how alarming the COVID-19 pandemic is impacting the African American community. In Chicago, 68% of the deaths there were African Americans. In Louisiana, 70%, but African Americans make up just 30% of the population in both places. And one Pittsburgh organization has taken notice, getting information out to our African American community to keep them healthy, safe, and educated. Channel 11's Ryan Houston explains.
A weekly conversation about race and the coronavirus was fueled after data was released showing that the virus was disproportionately affecting African Americans.
It was a feeling of, wow, we really need to do this, not just one time, but do this consistently and get information to our community that our community needs. So hopefully, you know, Black Pittsburgh and the surrounding areas can avoid the same fate as the Black communities in areas like Chicago and Detroit.
Desiri X is the founder of One Hood Media. His nonprofit is helping to put on the weekly virtual town hall called What Black Pittsburgh Needs to Know About COVID-19.
There were myths early on in the Black community that if you had melanin, you couldn't get corona, and you know, we just drink hot water, you know, 10 times a day. And so we just felt like it was important to have a medical professional.
Every week they have different topics and panelists from doctors, state lawmakers to healthcare workers. And they offer help for senior citizens, resources for mental health treatment, and break down the headlines surrounding the virus.
I really felt like I was heard, and it's a safe space to bring up those conversations, and I don't have to worry about, you know, flack or negative energy.
The cool thing about doing the virtual town hall and having it live on Facebook is we have community interaction. So we had about 500 comments.
They're not just all talk. The group bought 2,000 N95 masks to give to frontline workers for free. And their street team is going around in communities of color and putting up literature about COVID-19.
What we don't want to do is wait and take a wait and see attitude, because, you know, in all these other cities, it starts kind of in a more affluent community, but it really begins to devastate our community.
Ryan Houston, Channel 11 News.
Finally, here's a 1-minute, 15-second story that hits all the criteria of solutions journalism from KXAS in Dallas. Solutions journalism also includes limitations. It's not just a pie-in-the-sky story. Can you identify all the solutions elements here? You can add any comments you may have to the survey you return at the end of this workshop.
More than 80% of the students in Castleberry ISD come from families struggling financially. The district worked to give most of the students computers.
We have one-to-one computers for basically 4th grade on, but they're might as well be boat anchors, because what can you do with it if you cannot connect to the internet?
So the district invested $600,000 in these towers to send the school's own Wi-Fi signal out.
A cell phone network, basically like AT&T or T-Mobile would have, but instead of using an existing carrier, we have our own.
Who knew the project would wrap up right when coronavirus struck?
This is a huge game changer for us. We're not out scrambling, trying to buy hotspots, things of that nature.
Other districts have reached out trying to copy what Castleberry is doing. It was easier here because the district is just 7 square miles, but it could help the bigger districts fill the gaps and help students like they have in Castleberry.
And I've had several of them actually tell me how cool this is. They're thankful for it. They no longer have to use their cell phone to do their homework.
Do you need any more TV examples to help you understand how to use solutions journalism in your reporting? If so, please let me know in the survey at the end of this presentation. That last story you watched shows that solutions journalism can fit into a 2-minute TV piece. It may be light on depth, but if you include at least a sentence or two on each of the 4 pillars of solutions journalism, it's certainly possible. As an example, here's a very basic formulaic outline of a 2-minute piece that includes all the necessary minimum elements for a solutions story. So start with a person's story, 2 or 3 brief sentences about their struggles. Then include a short soundbite, maybe 1 or 2 sentences from that person to illustrate the problem. Describe the problem a little more briefly, another 1 or 2 sentences. Then include a short soundbite from an expert that clarifies the problem, 1 or 2 sentences. Now, describe the solutions in 3 sentences. Then include 2 more sentences in a soundbite from someone who's benefited from the solution. Now show some evidence of success in maybe 1 or 2 short sentences, or maybe a graphic. Wrap it up with at least 1 line talking about a drawback, a challenge, an obstacle, or a limitation of some kind. And there, you've done it, a 2-minute story that includes all 4 elements of solutions journalism, even if it's just a short mention. Okay, let's talk for a minute about some stories that seem like solutions journalism, but aren't exactly how we define the genre. First of all, hero stories. This is a familiar type of story, something we see every day and enjoy, about someone in the local community who helps people in a special way. But it's not solutions journalism because the core of this story is focused on the individual rather than looking at the broader issues at the heart of the problem. As worthwhile and heartwarming as these stories can be, a solutions journalism story looks into wide-scale systemic responses, not just individual actions. Next, stories that are almost public relations. These pieces highlight the opening of a new social program, an interesting new business, or an individual's achievements, but they lack any meaningful mention of the drawbacks, challenges, obstacles, or limitations of these efforts. Sometimes they also lack evidence of success, for example, when highlighting the start of an exciting new project that has no indications of effectiveness at the moment. Another one is opinions. Solution stories are not recommendations, guidelines, or opinions, either from educated experts or from the good insights of the average person. Solutions journalism covers things that are happening right now, tangible actualities that already exist. Instead, use ideas from these sources as a jumping-off point to inform your background story research. In other words, investigate whether you can use them as a basis for a full-fledged solution story. Consumer fix-it stories. This is a very popular TV staple and a classic example of service journalism. Consumer stories are a near cousin to solutions journalism, but not quite the same thing. This kind of reporting emphasizes how the station or reporter has taken a direct action to fix a problem for an individual or a group. In solutions journalism, a station or reporter does not actually try to solve a problem themselves. Instead, it reports carefully and thoroughly on responses others have taken to resolve a problem, how effective this has been, and any challenges that may remain. Activism stories. Somewhat in the same vein, solutions journalism does not ask a station or a reporter to take a position or to decide what might be the best solution to a designated problem, or urge others to take a specific direct action either. That's advocacy, not really journalism, and there's nothing wrong with that, but it's not solutions journalism as we define it. And finally, fluff stories. As we mentioned earlier, solutions journalism is not fluff, funny, cute, feel good, happy, positive news, as much as we all enjoy this at times. Like the story of Crispy Bacon, a disabled piglet who was fitted with a tiny wheelchair, although one could argue it was a solution for him at least. Do you understand the difference between solutions journalism and these story types that we lovingly call SoJo imposters? If you have more questions, please let me know in your survey at the end of this presentation. To repeat, your stories need the following elements to qualify as a solution story, even if it's just a brief one-line mention in a quick day-turn piece. It must cover the response to the problem and avoid hype or advocacy. Specifically, you need to make problem solving the center of your story around which all the other elements revolve. Dive deep into the how-to details of the response. Look at wide-scale, systemic responses to a problem, not just individual actions. Provide some kind of evidence of the impact and degree of effectiveness of the response. And make sure to point out any limitations, challenges, obstacles, or concerns about the approach. Okay, so let's look more closely at how to do solutions journalism, especially now during the pandemic. This is the question to remember above everything else as a path that leads you to solution stories. The question, who's doing it better? Make sure to repeatedly pose this question to your sources and interviewees. They may have thoughts about this, but might not offer the information unless you ask. Also, be sure to ask your colleagues if there might be a solutions angle to a story whenever you're pitching editorial ideas. Here are some other questions to lead you onto a solutions path in your interviews. Be sure to ask your sources things like, how does the response work? What parts of the problem aren't covered by the response? What does the research say about this response? How about critics? In what ways is the response working or not working? And how do we know? Is it being replicated elsewhere? With what effects? What obstacles might be in the way? Also, ask yourself, is there a general lack of awareness on a particular issue in the pandemic story that you want to cover? If so, perhaps it's better first to do a story that exposes the problem in more depth. But when the problem is clearly understood and people still do not know enough about effective responses that are working elsewhere, a solution story can provide the fresh angles and insights that people are seeking. Problems can often seem intractable, and solutions can sometimes seem like hype. Remember, you're not looking for a magic bullet, because there isn't one. The coronavirus pandemic is a huge, huge story with dozens of angles to explore. So, carve out a small slice of the problem and define your particular area of interest in it. Is it education, housing, food, employment, vulnerable populations, transportation, health, environment, or something else altogether? Find your own manageable slice of the pandemic, then look at solutions that address this one well-defined aspect of it. Would you like more questions to keep in mind when you're working on a solution story? If so, please let me know in the survey at the end of this presentation. So, where can you find solution stories? Well, in all the usual places you'd normally look for a story. Talking with academics, public sector experts, nonprofits, reviewing data sets and research studies, going back over your past stories and sources to look for new angles. But the main thing to remember is keep asking that question, who's doing it better? This will lead you in a solutions direction in your interviews. And please use our solution story tracker to find more examples of what's working on many aspects of the pandemic. It's one of our most popular website features, with a database of nearly 9,000 stories that have been vetted for the 4 criteria of solutions journalism. Use the story tracker to get a general overview of what's working in your topic area and to find sources you may want to contact. Sometimes we can also help connect you with the reporter through our network if you'd like. We now have a special category just for coronavirus solution stories, more than 500 of them at the moment, with several dozen examples from broadcast TV as well. Search by media type on the left-hand side if you want just TV stories. So where can you find evidence that something is working? Again, in many of the places you'd normally look to find a problem. Your interviewees, your sources, perhaps a similar effort that's produced results elsewhere, relevant experts, academic research, or people who have been directly affected by a response, as long as it's not just one or two. How much evidence is enough to qualify it for a solution story? Ask yourself and your colleagues, how satisfied are you that the data you find is credible and relevant? Remember, most early stage fixes don't have much evidence. So if you cover it, please be sure to also tell your audience what you don't know and promise to return when more is known to follow up. And then mark your calendar as a reminder. Do you understand what you need to know about finding data and evidence for your solution stories? If not, please let me know in your survey at the end of this presentation. We're all working from home right now. So how can you find, research, and cover solution stories without traveling in person to report on results? Here's some tips from our team. First, plan your story trip just as you normally would, making the usual phone calls to research where you'd need to be. Then don't go. Instead, outsource your eyes and coordinate footage needs with your sister affiliates. Stay on the phone longer to learn a bit more. Bring in a third person's perspective to evaluate the idea's effectiveness. Broaden the picture beyond the narrower story about an on-the-ground solution. Do you want to know more about how you can cover solution stories from home? If so, please let me know in your survey at the end of this presentation. Reporters, here are some story formats that work well as frameworks for solution stories. The positive deviant. When reviewing a database, look for outliers, but instead of profiling the worst performing example, flip the narrative to search for an example that changed significantly for the better. We call solution stories howdunits, not whodunits, because it describes all the dramatic challenges and unexpected obstacles that might have gone into creating a positive outcome. You've got plenty of good narrative tension here to create a compelling story arc. The instructive failure. Sometimes a solution story looks at a response that failed to some degree because it can provide useful details and constructive insights for communities who may be considering the same kind of response to a given problem. A classic format for solution stories is to include them as the final piece of an investigative series after the problem has been fully exposed and explained. At this point, audiences will be keen to know, okay, so now that we know we have a problem, what's next? How can this be fixed? Another good solution story format comes by comparing one place or one time to another. Even though life was very different in 1918, many of the actions that people took during the Spanish flu pandemic are useful lessons for today, for better or worse. This TV story, produced by Newsy, looks at what factors led to a successful resolution then in different regions of the world. You can add any comments you may have to the survey you'll return at the end of this workshop.
1918 saw the rise of a global pandemic that brought huge societal changes. That was a different time and a different, far more deadly virus. But looking at how 2 American cities handled the Spanish flu reveals an important lesson in dealing with our own pandemic. One city stopped the spread. The other created an outbreak. On September 28, 1918, 200,000 people lined Broad Street in Philadelphia for a grand parade to promote Liberty Loans to pay for World War I. Marching in the parade, troops, Boy Scouts, and marching bands led by the famous conductor John Philip Sousa. Hundreds of thousands of people all packed together, despite warnings that the deadly flu was very much active among nearby military camps. City officials and parade planners forged ahead. Within 3 days, there wasn't a single empty bed in any Philadelphia hospital. Within a week, with health services overwhelmed, the death toll had reached 4,500 people. City leaders closed down Philadelphia. By then, it was too late. But during that same time frame in 1918, a different city took a different approach and was able to flatten the curve, keeping the number of flu cases low enough that hospitals could deal with them. To understand the position these cities were in, you have to look back at the months leading up to their decisions. The virus that became known as Spanish flu first appeared in early 1918. Rampant among military bases in both the US and Europe, it spread rapidly as World War I brought opposing armies together in dire conditions. By the summer, the flu had tailed off enough that many health experts believed it was gone for good. But the fall brought a new surge of cases globally. And by September, city leaders across the US knew the flu had begun actively spreading again. St. Louis handled this information very differently than Philadelphia. Within 2 days of detecting active cases, St. Louis leaders had forced closure for schools, churches, and any public gatherings of more than 20 people. The virus still spread throughout St. Louis, but through this social distancing, the city kept its number of cases low and suffered far fewer casualties than Philadelphia. The steps St. Louis took a century ago look a lot like those taken after cases of coronavirus showed up in Singapore and Hong Kong, where schools and public gatherings were quickly shut down and the virus's spread was slowed.
Producers, your role is very important in conveying a commitment to solutions coverage to audiences, beyond the impact that one solution story in your show may have. So how can these stories fit into your newscast rundowns? As one news director told us, it doesn't have to be in a package. Have a reporter show and tell what works, or break out evidence into a graphic, or cover limitations in a Q&A with the anchor, or tease to solutions coming up on air or online. Or for a more in-depth approach, create a super block around one aspect of the pandemic that you want to highlight. Maybe problems in nursing homes, or with college students, or the travel industry, etc. Then look at every part of that manageable story slice by investigating the problem, providing background explainers, telling stories about the people who are suffering or who are helping, giving useful tips and pointing to resources, and highlighting what's working to address the problem by providing evidence of success and limitations in the approach. Now, doing this could easily take up an entire A block, but if that's not something you want to do, take that material and spread these stories throughout the day and promote them from show to show. Or instead, you could distribute the same material throughout the week and potentially gather it together for a weekend special with live guests. Do you have more questions about solution story formats or newscasts? If so, please let me know in the survey at the end of this presentation. To sum up, solutions journalism is a great way to build trust with your audiences. They know they can count on your station to tell them about problems in their communities, but also that you're sticking with them as you explore ways that might resolve their issues. For more info on solutions journalism, please register on our website to join SJN's Hub, where you can learn about new opportunities for training and other resources to enhance your solutions storytelling. Please also check out our Learning Lab, where you'll find our new TV playbook, a rich compendium of TV solution story examples, case studies from our TV partners, and tips on best practices to use in your TV news solutions coverage. The link to the TV playbook is included in your welcome email. And please send us your solution stories to include for consideration in our solution story tracker. It's a quick two-step process, and we'd love to highlight your work. We've come to the end of today's session, and there's only one thing required of you now, and that's to complete the survey via the link provided in your welcome email. All the questions are optional, except this one. What concerns, questions, and story ideas do you want to discuss at our upcoming live meeting? Please let me know in the survey that you can complete and submit now. Thank you for your time today. I'm really looking forward to meeting you virtually in our next live interactive session to go over your questions in more depth and to brainstorm some solution story ideas together too. In the meantime, please stay safe and healthy.